The holidays can be a tough time of year during a normal year, but this Thanksgiving, as COVID-19 cases surge, most of us can agree that we are grateful for our healthcare workers. News 5's Colette Bordelon takes us inside of Penrose St. Francis, where today just didn't feel like a holiday.
Normally, a holiday shift at a hospital is pretty calm, but as COVID does with everything, this Thanksgiving at Penrose St. Francis was stressful. A day of thanks.
We always work holidays.
In a year we'll never forget.
7-4, this is Karen.
Nurses like Karen Kaiser, working on the COVID floor at Penrose St. Francis, had a busy morning.
It's been a rough shift today and it's Thanksgiving, so that can be hard.
Fellow nurse Krista Polanco says several patients weren't doing well.
We're short-staffed and we hit the ground running this morning.
Things have changed since the spring.
Back in March and April, when COVID first started becoming like a big idea, we really didn't have hardly any patients.
Now getting hit hard, making them busier with patients who are sicker.
Some days I want to scream at people, even people I know that are talking about, it not being a big deal or it being blown out of proportion. Because we're here, we're living it.
Living the reality where patients need more than just medical supports.
We're definitely taking on the role of family at times, especially for the end of life times. We hold their hand and we wait with them.
Forming a connection that can't be put into words.
I can't imagine dying without any of my family around me. That would be really hard.
So this Thanksgiving, whether you're with family or not, thinking of those who didn't have them at the end.
This is hitting people a lot harder than I think people realize.
Makes us all remember what we're thankful for.
I'm happy that my kids are healthy and that I'm not in the position that some people are in right now, where they're saying goodbye to their family members.
Having our health and people fighting for it means more than any holiday. Centura Health is not publicly reporting their COVID numbers, saying they don't want to further disrupt health, well-being, or economic development, but they do say that information is relayed to public health departments like their ICU capacity, which they report twice daily. Always watching out for you, Colorado Springs. Colette Bordelon, News 5.